that need routine maintenance. The human being is made up of organs such as the heart, liver, kidney, and others which need to undergo regular checkups for better functioning. And so I pose the question, when was the last time you had a routine checkup? Dr. Klottey-Korle is here with me today. She's a family physician at the Klottey-Korle Polyclinic, and she will help us out. Good morning and welcome to the show, Doctor.
Good morning. Thank you very much.
Okay. So I just have a few questions. My first question here is, when we talk about routine medical checkups, what exactly are we talking about?
Okay. So when we talk about routine medical checkup, we are talking about the checkup where you either schedule with your doctor or you see your doctor. And at that checkup, we review your past health conditions as well as your current condition. And then we schedule screenings that you may need for whatever conditions you have for now. Okay. So that is what a routine checkup is.
Okay, thank you. So are there different types of medical checkups?
Yes, there are. We have the pre-employment, where you're going for employment. Certain schools require checkups. When you are traveling, pre-travel checkups are also available. Woman checks for women are also available. So those are basically the ones.
Well, since you mentioned the well woman check, perhaps you could just give us a brief overview of what that involves before I move on to the next question.
Okay, so for the well woman check, we are looking at checking the lady with the breasts and then the gynecological system for any conditions such as breast cancer or breast lesions, cervical cancer. We have cervical cancer screenings that we do. At the Well Woman Clinic itself, we have other things also, like preconception care, domestic violence, counseling, all those things are done there. But the Well Woman check itself, we focus on the breasts, the reproductive organs, the breast, and then the gynecological system.
I see. Yeah. And how easy is it for someone to actually have a routine checkup done at the clinic, for example?
Well, you can come in and get it done. Only that for us, it's a bit challenging because it's not on national health insurance. So it's you yourself have to come in, pay for it, and then get it done.
Okay. Yes. Dare I ask how much it costs?
Well, you would pay the normal consultation fee, and then the labs you do. Right. So looking at a give and take, a minimum of about 600 Ghana cedis, you'll be able to do one.
Okay. All right. And do you have any special checks for people who are elderly or perhaps people who are on medications for chronic diseases like blood pressure medications or for diabetes, for example?
Okay, so they come for their regular checks. So for instance, they've been scheduled for monthly visits, 2 monthly or 3 monthly, depending on whatever it is. When they come in, we check their blood pressure, sugar, and all that. For the elderly, we have routine checks. We have, for instance, at where I work, a geriatric clinic, where we see them, we check their mental state, cognitive state, we check how their memory is doing, we check whether their motion, mobility, and what they can do for themselves. So these are some of the things that we do for them as well.
Okay, and which of these checks generally are the most common that everyone ought to do? What are the things that certainly you'd recommend that somebody just has a routine check, especially since the year has just begun?
Yes, so for me, I think that, your blood pressure is very basic. You should know your blood pressure. And then your blood sugar. Right. Those are like the basic ones. Then you would also want to know the state of your liver, your kidneys, and then your heart. Those are like a basic test that you should be able to do.
I recently saw that there's an increase in the number of HIV patients within the country. So would it be something that, an HIV test, would that be something that you would do routinely now, or do you save that for when somebody actually asks?
We actually save it for when they ask. Okay. But if your medical, whatever you're going to do, your employment or whatever requests on their form, then you have to get it done.
Very well, very well. Thank you very much. And why is a routine medical check so important?
Yeah, it's very important because, like you mentioned rightly, the body is a machine and it needs checks. And, as you age or as you grow, there's wear and tear. And some of the things can be happening in a very hidden way. You may not pick it up until you screen for it. So It's very important. We pick up conditions, early detection of conditions which you can treat and even cure. Okay. And then in some cases you prevent risks because you monitor people who have certain increments of certain figures. So you monitor, and then also at those routine checks we offer lifestyle advice to help prolong lives. Because right now, what we are looking at more is lifestyle modification.
Yes.
What is your lifestyle? You need to change that. And all those are done during the routine checks.
Very well. Doctor, thank you so much. I just want to let our audience know that they can actually send in their questions or comments on a WhatsApp line 055 55 61034. So WhatsApp, you're free to send messages, and it's a 055 5561034. And remember, it's hashtag GTV Breakfast, hashtag GTV Breakfast Flipped, and hashtag MPs Takeover, just in case, I decide to choose a different career. All right, Doc. So is it advisable to do a yearly checkup?
Yes, it's actually advisable to do that. And one thing we always say is that you can pick a time in the year. We can advise you to pick maybe your birthday, the beginning of the year like now, the end of the year, something to reward yourself because you've been working hard. And I think that the least you can do for yourself is to check what your system is like. So we actually advise for yearly checks. Very, very important.
Okay.
Yeah.
Would you have a well-man checkup? Because you mentioned the women's. Is there something for the men?
Yes, the men too get checked, but I mean, it's not a very popular one in our part of the, but the men
I wonder
too.
why.
I think we'll have to look into that and see. Yeah.
Okay, so ideally, if you were to offer a well-man check, for example, what would be some of the things you would look for that would be specific to a man?
Okay, so specific to a man, you would want to find out about the prostate, the colon.
Yes.
Those are some areas that, in general, I mean, sexual health,
Yes.
how the man is faring in that direction too as well.
I hear someone in the audience saying correct about sexual health. I think that's very key.
Yes.
So one other thing, just with regards to blood pressure. Sometimes you have patients who have high blood pressure and are not taking their medications because they say that it affects, it causes erectile dysfunction. What kind of advice can you offer, for such patients?
Okay, so for such patients, one thing we'll let them know is that the high blood pressure itself can affect the sexual function,
Right.
as well as the side effect of some of the medications. If you are experiencing that, what we say is that come back to your doctor, report.
Yes.
We can change some of the medications for you. And in cases where we change and you are still having it, we have other medications that can also help you to function better.
Okay. And there are a lot of people who use herbs to treat disease alongside the conventional medication that they've been given. What advice would you give to such people, especially when they come in and they're asked if they're using anything? Some people say no because maybe they don't consider herbs or herbal medicine as, something to mention in their drug history.
Okay. So what we actually ask direct questions sometimes that are you using herbs? But what we say is that combining the two is not very advisable because sometimes the doses we are not sure about and we are not sure about the source. I mean, right now we are having herbal clinics training in the nation and all that. So they may have a more structured way of doing things that we don't know. But if it's just maybe something by the wayside, we may not know what you are really taking in.
Right.
And this may affect sometimes the kidneys and then the liver. So we don't generally advocate for that.
Do you do cervical screening?
Yes, we do.
What is the age range for that?
Okay, so for that one, we say that anywhere from 21 years, cervical cancer screening. I
Yes,
suppose.
that's correct.
Yes, anywhere from 21 or 3 years after onset of sexual intercourse.
Okay.
You can do a cervical cancer screening. Incidentally, this month, January, is Cervical Cancer Awareness Month.
Okay.
So we are advocating for cervical cancer screening all over. Women should come and get checked. When you get checked and it's normal, we have a number of years, about 3 to 5 years, depending on what you do, to get checked again. So it's something that every woman should look at this month of January. It's Cervical Cancer Awareness Month. One thing a woman can reward or a spouse can reward the wife or somebody with is to get them checked for cervical cancer.
Okay. And how much would that cost, the screening, the cervical cancer screening?
Okay, so there's a range. There's the visual inspection with acetic acid.
Right.
The lower end of the range. There's a pap smear and there's the HPV testing. All these are cervical cancer. So the HPV can get about 50 Ghana cedis. You can get that done.
I see.
And then for the paps, anywhere from 150 Ghana cedis to about 200 plus. And then when you add the HPV, what the HPV does is that human papilloma virus test. you add it to the pap screening, and we call it co-testing. It prolongs the number of years that you have to check again. It moves it from 3 years to 5 years. That can be a bit expensive, about close to 500 Ghana cedis
I see.
to get the two done.
So, Doc, just out of curiosity, because as a fellow medic, is it something that you would recommend that actually finds its way onto some kind of a scheme, so that the cost involved is actually reduced, or it's subsidized in some way, so that you have more people, actually more women availing of the
Yes,
service?
I agree. I mean, it's something that if it gets on a scheme, it will be very helpful, especially even the low end of it, because VIA is visual inspection with acetic acid is very, very, very effective, and that can also take about 3 years before you get it done again. So if it's on a scheme, because where I work, for instance, when we have people sponsoring, you get a lot of women coming in.
Yes,
So it means that finances is also a factor in that matter.
I see.
Yes.
Okay, thank you so very much, Doc. Yet again, I'll repeat the number for WhatsApp if there are any questions or messages: 055 55 61 034. 055 55 61 034. All right. So you can follow us on Facebook, Instagram, Twitter, TikTok, and YouTube. And that's GTV Ghana. Okay, so a few more questions for you, Doc. Just with regards to the routine health checks, are there specific ages which, when a person hits, they really should, at all costs, if they haven't had any medicals before, they should really consider having one done?
Yes. So by your 30s and 40s, you should consider getting one done.
That's for both men and women?
Both men and women, yes.
Okay.
Your 30s and your 40s. At least every other year, you can get one done. In the 20s, we say every 3 years. By your 30s and 40s, every other year. And then in your 50s, yearly, you should get it done.
Okay. Now, just with regards, since it's cervical screening month, I was just wondering whether you could perhaps give us just a few of the signs and symptoms to look out for that should perhaps raise people's concern, or a woman's concern, that when she sees, she should be a bit concerned with regards to cervical cancer, and then, of course, breast.
Okay. So with regards to cervical cancer, sometimes it's actually there are no symptoms. It's hidden. Then at times you can see blood, bleeding, or some form of bloody discharge in between your menses. You know, your menses should flow 1 month and another month. In between, you should not have any kind of discharge or any kind of bleeding. So any bleeding in between your menses can be something that you should be worried about. Also, pain during sexual intercourse should be also of concern. Pelvic pain, sometimes just pain within the lower abdominal area, should also raise some concern too for you. So those are a few of the. Sometimes when it has gone far, then you may have other symptoms of bone pain. When it has gone to other organs, then you have other symptoms of other organs as well coming in.
Okay.
Yeah.
Thank you very much. And with regards to checking for the breasts, are there, what would you advise that women should do on a regular basis, and when should they do it?
Okay.
With regards to checking their breasts.
Okay, so checking their breast for the women in their 20s, 30s, we say you should always do a self-breast examination. And that we say you should do monthly. Monthly, about 5 to 7 days after your menstrual period. You should do that monthly. And we advocate that you do it either in the shower, you can do it whilst you're bathing, or you can do it in front of a mirror. If I can briefly maybe demonstrate a little bit. So you can do it in front of a mirror. First of all, you are looking. What are you looking for? You are looking at both breasts, standing in front of the mirror. You raise your hands and then you look. You are looking for any lesions, any skin changes, any spots, any skin creases, anywhere, anything that is in your eye you haven't seen before on your breast, you look for that. Then when you finish looking, you need to touch. So for the touching, you need to touch your breasts. Now, I always say that you can divide your breasts into about 7 areas. What are the 7? So your inner upper part, the outer upper, the lower outer, and then the inner part, the inner lower part, and then the central part, that's your around the nipple. So you make sure that you press these areas against your chest bone. When you press it against your chest bone, if there's something in the breast tissue, you will feel it, or it will slip under your finger. So you press it and press all the areas. Don't forget that we have what we call the axillary tail, this area of the breast towards the armpits. Some have it more prominent than others. But the axillary, you need to check that side as well. And you check inside the axilla is simply the armpit. So you check inside the armpit as well, looking for any lesions within there. When you are done with all that, then you milk your nipple to see if there's any discharge. So basically, you should do this for yourself at least once every month. The idea behind doing this for yourself is that you get to know what your own breast feels like. So that when there's an abnormality, it will be easy to pick up. Because we've had people walk to us, in the clinic and say, oh, because I've been doing this thing, this time I felt this abnormality. So that's how we say. And then for those over 40, in addition to that, we advocate for them to get a mammogram done, as well as a clinical breast examination as well. When we say clinical breast examination, where you walk into the clinic and then you have a trained nurse or a doctor examine your breasts for you.
Wonderful. Thank you so very much. And now we have our messages coming in, and Dr. Kissy is going to actually read them out. The other MP who's taking over.
Thank you very much. I think my name, as she rightly said, Dr. Dixon Makukisi. And in fact, I must say this. I'm sure viewers are enjoying having very beautiful two doctors talk to them about their health. It makes us listen. Usually men listen when there are women on the show. So your first message comes to Dr. Zanetor, and this guy says that he thinks you should open a TV station. And not just that, help Ghanaians with health tips. And in addition, he's very sure Mama is watching you this morning. Interesting. And then we also have a second message here, also saying good morning to the two of you. And Dr. Klottey-Korle, greetings to your dad when you go home. And this also says that it is important that people know their blood type. Yeah. And I'm sure he also is adding genotype. And what he's saying here is that it helps you prevent certain illnesses, and he's a living testimony. I don't know which testimony he has. This is a season for testimonies, as you all know. And then we have Alhaji, who's coming in saying, wow, it's nice to have a member of parliament here reading the morning news. He's excited, but he has one thing which he talks about, which is hiccups, which has been worrying him. So I think I'll let Doctor address hiccups, which I think sometimes is a very serious thing when it comes to diabetes. But I'll let you make reference to that.
Yeah, so for those who suffer hiccups, what we say is that if you have other conditions, yes, you may know that may be the cause, but it's better you come in. We'll have to run some labs for you. Yes. Check your liver function, check all those, because certain derangements can cause it. Yes. And then when we get those labs done, depending on what you have, we'll attempt to correct. But we also want to start with non-pharmacological ways of stopping the hiccups before we go to other drug-based ways of stopping the hiccups.
Wonderful.
Yeah.
All right, interesting. Then all the way from Bolga East, he says that he's admiring your eloquence, Doc. And what is the normal blood pressure and a standard blood pressure? That's his thing. But eloquence, I don't know if that has any role in health, but please help him with regards to normal blood pressures.
Okay, so your normal blood pressure should be 120/80 and below. When we say 120 over 80. So your systolic is 120, the top one. So we usually say that your blood pressure is two figures. Some people, when you ask them, oh, when I did check, they said it was 150. No, it's usually two figures. Yes. One on top, one below. So below or 120 over 80. Anything above that, you are getting into either pre-hypertensive and then hypertension.
Thank you very much. And in addition, we have Moses coming in from Takrade. Today, I think the whole country is watching you guys. And then he's saying that he tuned in 5 minutes ago, but he's concerned about weight and how to manage it. So weight loss is a very important bit when it comes to health. So how do we manage our weight this year after enjoying a fantastic Christmas with lots of chicken and you know what? Yes, how do we manage it?
Yeah, so one of the ways is to come in and get a plan from a dietitian. Is very important. But maybe I can just chip in briefly on what we call lifestyle modification in general. And that includes eating healthily, fruits and vegetables. So as part of lifestyle modification, one of the things we say is that at least you should have 5 helpings of fruits and vegetables daily.
Hey.
I don't know how many of us are able to make it, but and when we are talking about helpings too, you see, we are not talking about just getting maybe, oh, some people when you come you say, oh doc, I eat fruit, so but this person has bought about 5 Ghana worth of banana together with groundnuts and is eating. No, each of the fruits have their portions. For instance, for banana, if it's the small ones, it's just about 2.
That you need. Okay.
If it's the long one, the foreign one, it's 1. If it's oranges you are eating, you are supposed to have 1.
Wow.
So there are portions that you should have. So if you are able to do this, you find out that making room for other carbohydrates and things within the day is quite limited. And that can also help you with your weight loss. The other thing is exercise.
In fact, there's this song that
Exercise.
talks about banana.
Really, Doc?
You know, it gets a lot of us eating bananas, you know. So maybe we should have a song on carrots, and we'll eat
and
carrots.
cabbage.
But there's a message interesting coming from my constituency, and he says that, you know, I did a health screening on the 29th. I do it annually, and appears he was there. It was fantastic. We had a blood bank there to take only 20 people manned up to have their blood donation. And let me use this opportunity to say that blood donation is very crucial. We need it for our pregnant women. We need it for accident victims. We need it for sickle cell patients and people with blood-related diseases, even cancers in the blood. So I'll use this opportunity to encourage more people, especially the men. The men shy away from a lot of interesting things. They are ready to pick up guns, but very afraid for a needle, a small needle that will poke them. So please, let's encourage people to donate more, so that we can save some lives. And in that sense, to those who are not interested in taking blood, too, that's for another day. We'll have that discussion. But whilst I have that, I think blood bank still has a huge shortfall, and we all should encourage them. Oh, interesting here. So there's a 23-year-old, and I believe he's very concerned about is it good to do sexual intercourse at age 23? That begs the question, when do most of us start sexual intercourse? Some say 16. Some say otherwise. Doc, what's your experience? Speaking from maybe your own experience, Doc. When is
don't you
it
start?
a good time to start sexual intercourse?
Actually, when I watch this is a very heavy question.
Interesting.
I mean, because
interesting.
sexual intercourse comes with responsibilities
Exactly.
and infections and other things. So you should be ready for all the consequences that comes with it. And I believe you should be in the position to handle all the things that comes with it. That's when you
Including
have to
pregnancy.
engage, including pregnancy. Yes.
Yes, and in fact, for the women, I would say that for delivery reasons, giving birth reasons, having the enough broadened pelvic is advisable you wait when your shape is fully set, and that will be above 18 going. So don't let any man trick you. These holidays are very troublesome, especially when you take in a few shots of liquor. And unfortunately, in talking about our health, people are mixing all kinds of liquor these days, whether local or foreign. And let me just add that in line with blood pressures, some alcohol and aphrodisiacs can elevate our pressures. I've had a few men come in because of elevated blood pressures after taking in, as they say, a few shots to help them in bed. And we know of stories of people dying whilst in the act due to elevated blood pressures. So maybe I'll let you talk about sexual health a little bit whilst we're on this topic. Very, very important. They say if it's not on, it's not in. Please elaborate on some of these things for us.
So what we usually say is that, I mean, if you can abstain till you're ready it's fine. But if you are going to do anything, then you make sure that you are protected, because there are a lot of conditions around that you can pick up, sexually transmitted infections, HIV, that you can pick up, and then also multiple partners. You need to be careful with that. And this also even is one of the risk factors of cervical cancer. Multiple sexual partners, and then also multiple sexual partners of your sexual partner that you don't even have much control about. Yeah.
So this
Doc, just to
last
quickly
okay.
get some more information, what did she mean by protection? Doc, what do you mean by protection? Because he said something about if it's not on, if what's not on.
Use.
Condom use.
Condom use.
Yes. Yes.
To avoid any
Condom
ambiguity.
use,
Yes. Yes.
Okay.
Condom use. Very important. Now, this next message is about stammering. And he wants us to talk about, stammering and how it can be attended to. Some of us, I remember anytime my teacher would ask me a question, I learned to stammer because the knowledge isn't there, and you find it difficult expressing yourself.
Yeah.
So stammering, what's your advice on stammering? What's your advice?
So what I would say about stammering is that we have speech therapists that can help with it, but basically you also have to condition yourself in a certain way that yes, you can get some help. Sometimes it may not go away, but you must still maintain your confidence. And then when you have confidence and when you are speaking knowledge and you are even stammering, people stop to listen to you. So you have to build that inner confidence. We have one of our colleagues who stammers, and she speaks a lot of knowledge. We listen anytime she speaks. Yes. So you make sure that your knowledge base is good and you have the necessary attention.
Wonderful. Thank you, Doctor. Doc, we have two more. We have space for two more messages, and then we're going to take a break.
So, good morning, my beautiful doctors. Wow. That's nice. I do mix a lot of fruits and blend. I do this often. Are there any negatives to this? Let me squeeze in one. I think that when we take in too much, for instance, pineapple, you might increase your blood sugar level. So it's important to check. If you're not diabetic, then you can have some fruits. But I'll leave that to you, Dr. Klottey-Korle, to educate us on overtaking of fruits.
Yes. So that was why we mentioned that, helpings. We are talking about the helpings, because each of the fruits have things that can go overboard, like sugar, Doc mentioned, pineapple, watermelon, mangoes, they all have sugar in them. Bananas can have some level of cholesterol within them. So that's why we talk about the helpings. You can't just eat it because it's a fruit. You must do it within it. For instance, if it's a kata fruit, then a saucer full. So if you can blend maybe a saucer full, maybe an orange, in moderation, then you can drink it. Yeah.
Okay.
I couldn't help but...
Your last message has to be really short.
Yes, I couldn't help. This also from my constituency, and he's worried about our traffic lights. Yao, thank you for that. I'm fully aware. I actually drove by this morning. Thank you. And I'm sure Roads and Highways is also watching us this morning. So, Yao, thanks for bringing us up to Ghana. Thank you very much.
All right. Thank you so very much, Dr. Kisi. That was really good. You should probably have a TV show too. Dr. Klottey-Korle, thank you very much for everything. I hope that our audience has learned so much today. And for those of you who've never had a health checkup, this is a good time to start. And those of you who know about doing so, just keep doing that and get to know your bodies. Mind your diet, exercise regularly, and hopefully, by doing all of that, you'll have your health, because that's all we have, there's no substitute for it, like we said earlier on. So I'd like to thank you very much once again.
Thank you.
Wish you a wonderful year.
Same to you.
Thank you very much. All right.